Now, in sports medicine, there's lots of different people who can be involved. And as I've been asked many times before, you know, am I a physiotherapist? Am I a surgeon? Am I a chiropractor? And uh, what I would say is no, but I do have an understanding of what all these different healthcare practitioners bring. Um, but a sports doctor, there's two types. There's two categories that you may think about. Now, I am a sports medicine consultant. So what that means is I went through a specialist training, um, and I completed a series of exams, and that enabled me to register on a specialist register, both here in Singapore and in the UK, to have the nomination that I'm a sports medicine consultant. You may come across some doctors who say they're sports doctors, physicians, sports specialists, and there's a variety of different connotations and names that people adopt. And often these colleagues may be someone who's done a master's or a diploma in sports medicine. Here in Singapore, we have the graduate diploma in sports medicine. In the UK and overseas, there's a variety of different master's options as well. And these doctors, while they may not be on the specialist register, they may have a specialist interest or special interest in sports medicine. So it's the real kind of it's a very subtle definition or differentiation between the two. Sorry, subtle differentiation. And the key thing is that the sports medicine consultant will have gone through a specific training program, whereas the sports doctor or sports physician may not necessarily have gone through that program itself. So sports medicine consultants, sports medicine consultants are medically trained doctors. You usually complete a primary medical training. Um, so that obviously that's your medical school, and then you go on to a base training either in family medicine, emergency medicine, internal medicine, or rehabilitation medicine. And depending on where in the world you live and your training, it may vary. So in the UK, it's typically as well, UK and Singapore, it's typically family medicine. Overseas in the US, it's typically rehab medicine. And sometimes there are doctors from emergency medicine and internal medicine who decide to, after they've done their membership, to go on to a sports medicine subspecialty. So then you subspecialize using with postgraduate diplomas, certifications, and there's specific training programs in sports medicine. So in the UK, there's the Faculty of Sports Medicine. In Australia, there's the Australian College of Sports Medicine, and in Canada as well. And then after that, and in some places, it's more about fellowships or residencies. So in the US, after you've finished your rehab medicine, you do a 2-year sports medicine fellowship or residency. As was mentioned earlier, I trained at Barts in the London. So I started, you know, probably well before many of you were born, back in 1998. And back then, I started my medical school. I finished intercalated bachelor's in neuroscience, thinking, oh, neuroscience was very interesting to me at the time, back in 2003. And then I finished my medical degree in 2004. After that, I did my houseman and medical officer, or in the UK, you call it senior house officer training. And then I went into my primary care, so it's family physician training in 2010. I completed it in 2010. And then I started my sports medicine training that same year, which I completed 4 years later. So as you can see, there's quite a number of years of training and experience that's required. And even after you finish, there's a lot of learning to be done, and I'll come on to that later on. As a specialty, it's actually sports and exercise medicine. So, although we kind of condense the name to sports physician or sports doctor or sports medicine consultant, it's actually a sports and exercise medicine. So, part of it is working in the sports environment with musculoskeletal injuries, But also it's about exercise prescription, health promotion, really integrating exercise as a key factor into a whole variety of different medical specialties, including uh, cardiology, respiratory medicine, endocrinology with diabetes and so on, obesity, and really sports medicine sort of infiltrates a lot of different specialties to bring in that exercise medicine role as well. One of the big things that's happened in exercise medicine is also the American College of Sports Medicine have developed this program called Exercise as Medicine. And again, sports medicine physicians have been very central to rolling that out in different countries.